Naheed, the CQC released their latest report on monitoring the Mental Health Act, and once again that's kind of thrown light on some of the racial inequalities experienced by people accessing mental health services, which places added focus onto the importance of the patient carer race equality framework, or PCREF.
Yeah.
Maybe if you could just kind of take it back to the beginning for us and talk about what is PCREF, why was it introduced?
Yeah, sure. The Patient and Carer Race Equality Framework, PCREF, is a national anti-racist framework in England that all mental health trusts must implement by 2025. The ambition and the aim of this framework is to introduce and implement measures that will improve access, outcomes and experience for racialized communities. And it's these racialized communities who are experiencing disproportionate outcomes and experiences in their mental health services. And that's what I'm referring to in terms of the CQC report that's highlighting some of the stark statistics.
Yeah, absolutely. So can you tell me a little bit more about the framework you mentioned?
This framework will become also part of CQC inspections. So it's mandatory. It's not a choice. It will be a legislative legal requirement in terms of inspections, in terms of how a trust performs. So all NHS mental health trusts will be expected to demonstrate an action plan that is focused on three key areas. They're around, first one, leadership and governance. And this is making sure that organisations are held accountable to embed race equality in their policies and what they do in the future, and in terms of the culture of the organisation. The second key area is around data and performance monitoring. Now, we know data is gold, how important it is, but when you haven't got a data collection that's robust enough around racialised communities, we're not going to be able to measure disparities, track them. We're not going to be able to measure or evaluate how good or bad a service is, and even see where performance is going, and also introduce targeted interventions. So robust data collection, analytics is crucial to this PCREF framework.
Yeah, of course.
And the third area is around patient and carer voice. Of course, the PCREF is about the patients and carers, and it's for them as well as the organisations. So one of the ways that you can make sure that we're serving the communities and ensuring we have services that meet their needs and are culturally competent is to ensure that they're involved in co-design. It's no longer about taking a service to the community, and expecting communities to adapt to what we created, leading the NHS Trust. This is about co-production, co-development, and bringing racialised communities into the mix at the table, and designing and shaping those services so it meets their needs.
So moving away from that old kind of narrative around hard to reach communities and actually designing services that meet the needs of those communities.
Absolutely. And how better to know how to meet the needs of communities, but to ask the communities. And we learned this in abundance during COVID-19, where we again saw similar disproportionate impact of the virus itself in terms of outcomes, experience. I mean, all the things we're talking about in terms of mental health right now, right? So it's just another area where we're seeing exacerbated inequalities. So the PCREF is here to put a handle over this and have an accountable element. So those are the three areas, but woven within those three areas of leadership and governance, data, and patient and carer voice are organisational competencies. And these are essential competencies that will ensure that the workforce is trained well. You can't have an organisation that's culturally competent if the workforce aren't trained in how to deliver it, and policies aren't developed in line with that. So these organisational competencies are also a crucial part woven throughout the PCREF framework.
So you talked a bit about kind of the impact on outcomes and experience on racialised communities, both under the COVID pandemic, but also in mental health services, as highlighted by the recent CQC report. How do these kind of inequalities actually affect individuals and communities in the sphere of mental health?
The impact of this is huge, it's profound. Discrimination, stigma, mistrust, the experience of individuals who feel sometimes healthcare professionals aren't understanding their needs, and therefore the intervention isn't the right intervention. It's huge. So there's so many layers to it. It's multifaceted, and I think that's why, in terms of trying to pin down inequalities in one place, isn't the answer, and hence the framework is multidimensional as well. And when patients or carers do access the services, when they finally get there to be able to, navigate through the different experiences that we've been told they've had, the services fail to meet their cultural and emotional needs. So this leads to poorer outcomes.
Yeah, of course. Have you got any evidence or statistics that give a kind of flavour of the impact that this can have on individuals and on communities?
What we know from, there's a plethora of information evidence, and you've mentioned the recent CQC report. We know that individuals from Black communities are more likely to be detained under the Mental Health Act, 3.5 times more likely than those from white backgrounds. People from the South Asian community, there's a lot of stigma attached around to mental health and diagnosis, and often this then leads to late diagnosis, and there isn't a door for those individuals to go to, or families, because of the stigma. And we've heard many ethnic minority groups reporting that they're just not understood, or again because of the lack of cultural competence or being able to translate some of those services specifically. There's huge amount of statistical and evidence, and even the experience tells us, feedback tells us that there's just a low level of attention to these racialized communities.
Right. Yeah, so I guess, if I were the PICREF SRO in a mental health trust, what practical steps can I take now to make sure that not only that I meet the requirement for implementing the PICREF framework, but also that it's actually implemented in a way that's effective in making my organisation more anti-racist?
Yeah, and this is the crucial bit, isn't it? And the PICREF is meant to be implemented by March 2025. That's now. So hopefully trusts are already on the way, and they would have different approaches, I'm sure, embedded within their practice that lend themselves to PICREF. So certainly around leadership and organisation buy-in, ensuring that executive teams and the seniors who champion the PICREF, so that can really be embedded effectively into the governance structures. We're serious about this.
Yeah.
The community and patient engagement is crucial and at the heart of this, of course, and to establish those meaningful partnerships with the racialized communities is crucial. Co-production, different workshops, exercises, patient-led advisory groups.
Yeah, and I guess in order for that to be effective, the staff in my organisation are going to need to receive kind of proper training and understanding about how to do that well.
Yeah, absolutely. Developing training programs for staff that allow and ensure culturally appropriate training, and also an awareness to challenge the unconscious bias. A lot of times we haven't had that appropriate training, so how would we know what we don't know? So this is that opportunity to train.
Yeah, absolutely. And you mentioned before about the importance of kind of underpinning those improvements in governance and those improvements in engagement with meaningful data. Tell us a bit more about what that could look like.
Yeah, so having that robust data collection and analytics space, we want to track disparities. We want to know, have we closed the gap, be able to measure the impact of the PICREF, but also how we're delivering services through our trusts. Evaluate the service improvements, what works, what doesn't work well, how can we improve. And data is, as I mentioned, is gold, and it allows us to drive targeted interventions as well. So this information within these communities and tracking it through our data performance is also crucial.
So really you're saying that in order to implement the PICREF effectively, mental health trusts need to have a kind of a multi-stream programme of work to address all of these areas, complementing each other to ensure that there is embedding and accountability.
Absolutely. So we can say, we've got all of these data, we've got governance practice, patient care voices and feedback involved. But how do we know? How do we know it's making a difference? Well, this is a really important step to ensure that information, data intelligence is measuring and collating this. And again, we're only as good as the data that we know, qualitative and quantitative. So this is an area where data hasn't been collected robustly and we do see a lack of insight. So this will really help us, understand the improvements and the areas where and celebrate where we've done really well as well.
Yeah, and so presumably as well as the reporting improvements, there's some kind of more basic stuff around data collection, around recording ethnicity and other protected characteristics when people start to access services.
Yeah, spot on. The protected characteristics which other hospitals, general hospitals have. We have them at GP practice level, and again, that's getting better and better. But mental health trusts, again, often there isn't that widespread collection at that level. So this is encouraging and supporting that behaviour as well in terms of data.
So you've talked quite a lot about what we need to do in mental health trusts to implement the PCREF framework. But I guess one of the big pillars that you talked about is making sure that the trusts are engaging with communities. So for people in those racialised communities, how can they get involved in the PCREF process in their local mental health trust?
And that's a brilliant question, Michael. And PCREF is about them and for them, and this is really important that both sides are involved. So the trusts in terms of their provide roles, but the community in terms of what they need. So their involvement is really, really crucial. Sharing the experiences with the NHS Trust to say, this works, it doesn't work. So directly from patients and carers.
Yeah.
They can get involved with joining different advisory groups and share the experiences. Again, this will help shape the services and guide and co-produce. Hold services accountable. This is for them. And if something doesn't work and the PCREF hasn't been implemented the way it should, they can challenge them. They can ask the trusts, do you have a PCREF implementation in place? What's the progress on it? We'd like to get involved. So be really active. And mental health care is about everyone, including the workforce and the providers. So bringing that dynamic and harmonising it so there's a co-production element around it is absolutely crucial.
Right, so we've covered quite a lot of ground today. I mean, we've talked about the kind of background to PCREF, why it's important, the legislative framing for it, how it's structured, what mental health trusts need to do to make it happen, and how communities can be involved themselves. It feels like it's a really positive change happening. I guess, is there anything else that you want to say in terms of what needs to happen next and what the next steps are?
Absolutely. Mental health care is for everyone and it needs to work for everyone. We shouldn't have a situation where if you're from a different ethnic or racial community and background that you'll experience different outcomes and experiences. And so the PCREF really, really will ensure that health services become truly equitable for all. Building trust, improving care and tackling racism in healthcare is a big area of focus. So for it to succeed, we've got to work together. The communities, our patients and carers need to come forward as well and join in with this mission. And that's how the PCREF will work. And NHS trusts need to embed it and embrace it and go with it. Working together, being co-producing, co-designing services that work for all.
Great, thank you.